Choking. The airway is the passage that connects the nose and mouth with the lungs. Choking occurs when the airway becomes partially or completely blocked by a foreign object, a piece of food or small toy, by swelling in the mouth or throat, or by fluids such as vomit or blood. If the airway is blocked by the person's tongue or swelling, this is called an anatomical obstruction. If it's the block that physically objects, and this is the called the mechanical obstruction. Children younger than 5 years old have particular high of risk of choking because their airway is about the size of their little finger. But a person of any age can choke. Completely choking, complete choking happens when the airway is completely blocked. When a person is experiencing complete choking, he or she is unable to breathe and is in a life-threatening situation. There is immediately first aid if possible medical intervention is required. Whatever the blocking airway prevention, and this is the following, it may reduce the risk of choking in adults. Chewing food well before the swallowing. Eating slowly and calmly. Avoiding talking, laughing, walking, or other kind of physical activity while chewing the following may reduce the risk of choking in children and babies. When babies start eating solid food, begin with the purse as opposed to solid pieces. Always supervise children and babies when they are eating. Teach children to calm easily, chew properly, and not to speak when a mouth of food. Encourage children to sit while eating. Make sure that babies or young children cannot reach objects small enough for them to swallow. And remember that children can choke on soft plastic. For example, the cut of corners of milk bags, the rubber, and the burst of balloons, as well as a hard object. So keep these items out of reach. So what will happen if the choking is a back blows? First, you need to stand behind the person or kneel if you are significantly taller and wrap one arm diagonally across the person's chest. Second, bend the person's forward of the wrist until the upper airway is at least parallel to the ground. 3. With the heel of your free hand, deliver up to 5 firm back blows before the shoulder's blades. If the abdominal thrust. First, stand behind the person and ensure that your stance is stable. If the person is much shorter than you, it may be more effective to kneel. Second, wrap your arms around the person's waist. Make a first and place it just above a belly button. Third, cover your fist with your other hand and give up to 5 quickly inward and upward thrusts into the person's abdomen. If the chest thrust, first stand behind the person's or kneel if you are significantly taller and wrap both of your arms around the person's chest under the armpit. Second, make a first and place it in the middle of the person's chest with your thumbs facing inward and place your other hand over your fist. Third, give up to 5 chest thrusts by pulling straight back to you. If you can't find your thrusts are not effective, pull more sharply and deeply. What if the choking of the baby less than 12 months? First, sit or kneel holding the baby. Second, position the baby with face down along your forearm, holding his or her jaw in your hand. Third, rest your forearms on your legs so that the baby head is lower than his or her body. Fourth, deliver the 5 firm back blows between the shoulders blade with the heel of your free hand. Fifth, if the object has not been dislodged, turn the baby face up. Ensure you support the head. 6. Place 2 fingers on the middle of the chest just below the nipple line and quickly deliver 5 firm chest compression pushing down 1/3 of the chest depth. 7. Repeat the firm back blows and the 5 chest compressions until the object is cuffed and the baby starts to cry or breathe or cough or the baby becomes unresponsive. After the object comes out, an object lodged in airway can cause damage to the sensitive tissues in the trachea and back of the throat. This causes bleeding and swelling. Any person who has suffered complete choking should always seek medical attention, even if the object comes out. If you have done back blows, abdominal thrust, or the procedures may have caused damage in addition to the damage caused by choking itself. So any person give this care should be assessed in the hospital. A person has experienced partial choking should seek medical attention if he or she experiences any kind of respiratory distress after the incidents. The person should be monitored for several hours after the incident to ensure that there is no damage. If there is no sign of injury in the first few hours, the person is probably fine. Unresponsive choking: if the choking person becomes unresponsive, lower him or her to the ground as safely as possible and immediately begin CPR, starting with a chest compression. In the short of breathing, a person is having difficulty breathing is a respiratory distress. A person who is not breathing is in respiratory arrest. Both respiratory distress and respiratory arrest are breathing emergencies. Respiratory distress is especially dangerous in children, as it can quickly lead to cardiac arrest. Any child showing signs of respiratory distress is in a potentially life-threatening situation and must receive immediate care. When a person is experiencing a breath emergency and oxygen supply to the person's body is either briefly reduced or cut off the entirely. So if the person to act of phase or once, if breathing stopped or restricted long enough, the person will become unresponsive. The heart will stop breathing and body system will quickly fade and brain cells begin to die after 4 to 6 minutes without oxygen. A breathing problem can be identified by watching and listening to the person's breathing and by asking the person how he or she feels. If a person is having trouble breathing, do not wait to see if his or her condition improve without intervention, but begin providing care immediately. First, respiratory distress common causes. So respiratory distress may be caused by any of the following. First, hyperventilation. Second, asthma, chronic pulmonary distress or COPD, pneumonia or bronchitis, an allergic reaction, anaphylaxis, heart failure, chest trauma, poisoning, a drug overdose, electrocution, or a certain mental health condition or a panic disorder. And what to look for: the following are signs and symptoms of respiratory distress: shortness of breath or gasping of breath, trouble speaking in complete sentence due to difficulty of breathing. Next is cheesing, gurgling, or high pitch. Provide reassurance. If this can happen, reduce anxiety and help the person's control his or her breathing. 4. Monitor person's condition and provides continual care until EM's personnel arrive. Hyperventilation is a condition in which a person is breathing much more quickly than usual. This upsets the body's balance of oxygen and carbon dioxide. Common causes: the following are common causes of hyperventilation: strong emotion, as such excitement, fear, anxiety, asthma, injuries, especially injuries to the head, exercise, life-threatening, and bleeding. Prevention: if you tend to hyperventilate due to anxiety, panic, or stress, relationship techniques such as breathing exercises may help. If you hyperventilate due to the diagnosed medical condition, speaking to your doctor will help you to learn how to treat or control it. Myth information about hyperventilation. If a person is hyperventilating, you should have him or her breathe into a paper bag. This practice is unsafe and not recommended as a way to care for hyperventilating person. The way to treat hyperventilation is to encourage person to take slow, controlled breathing.